Since 1990, MILEX pessaries have been an effective, non-surgical treatment for women with pelvic organ prolapse, offering supportive structure for the uterus, bladder, and rectum. This video demonstrates the insertion and removal technique that can be used for the MILEX ring folding pessaries, as well as the incontinence ring and incontinence dish with support pessaries. This includes the ring, ring with support, ring with knob and support, ring with knob, incontinence ring, incontinence dish, and incontinence dish with support. Each device has specific indications for use that include Stage 1 or Stage 2 uterine prolapse, stress urinary incontinence, and mild cystocele. Please refer to the product IFU for each device indication. To insert the pessary, wear dry gloves and lubricate only the entering end of the pessary. Fold the pessary along the axis of the bigger outer holes by bringing the small round holes together. The knob should be at the top of the arch, with the arch formed pointing downward. Direct the pessary past the cervix into the posterior fornix. Allow the pessary to open again in the ring shape after passing the introitus. The index finger is inserted deep into the vagina to turn the pessary approximately 90 degrees, so that the knob is resting behind the symphysis pubis. For ring folding pessaries without knob, it's unnecessary to rotate 90 degrees during insertion and removal. You should be able to sweep one finger between the pessary and vaginal walls. If the fit is too tight, try the next smaller size pessary, as it may cause patient discomfort. If the pessary is too loose, it will not be effective, may rotate, or even be expelled. Have the patient sit, stand, and bear down. Examine your patient while she is standing to make sure the pessary has not shifted position. She should not feel the pessary once it is in the correct position. To remove the pessary, use one finger to depress the perineum. Turn the pessary until the notches face the introitus. Fold the pessary and gently ease it out. MILEX pessaries are a viable first-line therapy for relief of prolapse symptoms. They are available in various shapes and sizes and provide non-surgical management to suit you and your patient's needs. To learn more, visit coopersurgical.com or call 800-243-2974 or 203-601-5200.